Hi, I'm Dr. Duqua with DK Chiropractic, and I'm here today with a good friend of mine and mentor, Dr. Curtis Martin. Dr. Martin has been practicing in California for over 20 years, and he and his wife manage three successful clinics in the East Bay area. He has become an expert with the SoftWave technology, and we're super excited to have him with us today. Welcome, Dr. Martin.
Thank you, Dr. Dewan. I got to tell you, I'm excited to be with you today. I know that you and I got introduced by a good close friend of ours, and that's what it is in the chiropractic community. A lot of us are, we know each other, we communicate each other, and especially with technology, when things really, really work, we have to share it. I know that, Dr. Shannon Connors had shared this machine with you about the power of it
Mhm.
and then introduced us. So I'm thrilled to be on the phone today and thrilled to tell you a little bit more about the SoftWave and what it's done for my clinics here in the East Bay. So thank you for having me on.
Oh, you're welcome. Great. Well, we're excited to hear more about it. Would you please share with us more about software
Yeah,
technology and more about how you're seeing it improve patients' lives?
absolutely. And like I say, being in the East Bay in California, three offices, me and my wife have been practicing. We were always subluxation based, which means we're always looking for where the body's interference was, correcting that interference and allowing the power that made the body heals the body. And then, unfortunately or fortunately, how you look at this, unfortunately, in 2016, I was in a horrible accident. It left me in the hospital and I couldn't walk. And as I was looking at options, what happened was this accident ripped all the ligaments out of my lower back. So there was no stability in my spinal cord. And so I couldn't walk. I was literally bedridden. And so they took me out of the hospital in a wheelchair to get down to the car. And then I had a walker when I was at home. And so the surgeon told me the only thing that you could do is surgery. And being a doctor of chiropractic, knowing the principles, how the body works, I was like,
Mm.
I'm going to try to explore any avenue to avoid surgery. And it left me with a good close friend of mine said, well, have you talked about or heard about stem cells? And at that point, I really hadn't, even though that in school I had a minor in cellular biology in undergraduate, but I knew how cells work, but I really didn't understand stem cell. A couple of years ago, in fact, 2.5 years ago, I got introduced to SoftWave, specifically the Litho Gold 100, the machine that I have in my clinics, but also now that you have. And it was absolutely instrumental on helping me get well. So I got introduced to stem cell, introduced to cellular detox, introduced to how this machine works. And in Germany, this machine has been shown and tested for several decades that what it does is it uses a very special acoustic wave. So if you will, if you're listening to this, you wonder, well, what does this machine do? It's not going to inject new stem cells, but what it will do, the probe head will send a very special energy into the body. It's a hydroelectric sound energy. It travels over 3,000 feet per second. So or actually miles per hour, very quick. And when it passes through normal tissue, it doesn't do anything. But when it finds damaged tissue, so no matter what the damaged tissue is, whether it's a shoulder, a back, a knee, upper neck, degeneration, disc degeneration, carpal tunnel, elbows, knees. If you got knees that are degenerating and don't have enough cartilage in them, and you're like, what should I do? Well, this machine will send an impulse into that area. And what it does is it does three things very, very well. Number one, it'll bring more blood flow, and everyone knows that blood and oxygen helps the body heal. But it also gets rid of those old swollen cells. We call them senescent cells, gets rid of those. But the number one thing it does so good that really helped me, and it's helped so many of thousands of patients in my clinics, is it releases the cell to release a cell signal called an exosome. An exosome is like a fuel pack that actually goes through. So if you don't have enough cartilage in your knee, let's say, it'll find those cells and it'll
Mhm.
activate and stimulate those cells to butter to grow, and therefore producing more cartilage. So if some of you are walking around with knees that are really painful and they say, oh, you need a knee replacement, we've helped so many people avoid surgeries, injections, regular prescription medication by releasing the cellular innate intelligence to release enough cells to regain that person's function. And that's what the machine does. My stories, it helped my back. It's like, say, it saved me from going through that surgery. My back is damaged, but it's functioning so much better now that I've had all this stem cell work and this SoftWave machine. So that's why I'm thrilled to talk to you, because I mean, think of all the people that probably are listening to this that have a problem that hasn't healed, that don't have hope. And now that you've been lucky, and I know that you're the only one on the islands, in Hawaiian Islands, that has one of these machines. Everybody else that wants to try this machine, you have to fly to the mainland. And even when you get to the mainland, there's less than 600 machines in the entire United States. So great job on getting the machine, and your community is so lucky and blessed to even have the opportunity to try it. So I'm thrilled for you, Dr. Du, and I know that you have a very special plan to make sure that each one of your practice members, their family members, their friends, their coworkers, their neighbors, just within your community, get an opportunity to try it. So I know you talked a little bit about it, but maybe you can share that with your group, your office, your community. Go ahead, Dr. Du.
Yeah, we're definitely the current patient. I'm spreading the word out about the
Great.
SoftWave machine. Definitely is filled up with the interest rate is pretty high demand. I didn't expect it.
Yeah.
So actually, so it was pretty good, and everyone wants to try on, and besides on that, we'd love to kind of share with your family and friends who has been suffer with the other issues. Definitely, this machine is phenomenal. I
Yeah.
guess if you wanted
No.
to get on the schedule to our office, definitely just give us call to front desk and
Yeah.
ask about the SoftWave TRT treatment doll. Yep.
Wow, that's great. And it's like, say, I love how you're going to take care of your patient base and their friends and family first before you even offer
Hmm.
the, I know you mentioned that. And so that's what we did in
Hmm.
our office, is we gave it to our patient base first. So I know Dr. Du has a special list that if you want to be on that special list at the front desk, he's going to put everyone's name that wants to be able to have an opportunity to try it. And those people get to go first. They need to be, your patient should be first in line, and they will be. And then after that, I
Hmm.
know you're going to set up some special times for them as well to make sure they get the machine. So I'm
Yeah,
excited. I think
definitely.
about, my closing thoughts for you is like, you only have pain and dysfunction and the things you suffer with patients every single day that you could get rid of, and you won't get rid of them unless you try. So I'd encourage that
Mhm.
every single one of you, this has been shown and tested to work so good. And I know that you're gonna be able to try this machine. Some of you will cry because it's probably the first time you felt relief in some of these areas. It's just absolutely, unbelievable. It doesn't hurt. I've tried it on kids all the way to my oldest patient's been in their 90s, and all of them, no matter what the injury is, whether it's a child that's fallen off the playground or a 90-year-old that all of a sudden has some knee problems, this machine has just been super helpful with every injury. And I've seen people that couldn't walk, barely use the machine, and were able to walk without pain.
Mhm.
I've seen all of a sudden canes get left behind. I've seen
Mhm.
shoulders that didn't want to move for years. All of a sudden they start to move them again, and spines that have had years and years of uncomfortableness, that comfort level and that ease has been able to be given to them. So if I know, I get so excited. I wish every single person listening to this would say, as soon as this ends, is to hang up, call Dr. Du and say, I want to be first on the list. And that's my hope and my prayer for you guys. So thank you for
Oh,
having me
thank
on,
you.
my friend. Yeah.
No, thank you. We appreciate you being here.
Yeah. Well, I can't wait to hear the results. So I know that as these patients, even though I'm not there in
Mhm.
Hawaii, I hope to hear my Hawaiian family giving me all the great feedback of all the different people that are getting well and staying
Uh-huh.
well. So I'm hoping to hear good reports from the islands. So thank you.
Good. Yep. Thank you, though. I'm looking forward to it.
Okay. Well, bye for now. We'll take care.
Yep.